Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. And good morning, everyone. My name is Rini Rachmawaty. I'm from Faculty of Nursing, Universitas Hasanuddin. Today, I'd like to present the result of our study entitled Healthcare Quality Received by Insured Patients in 2 Indonesian Regional Public Hospitals. In this study, I am the principal investigator and I work with other co-investigators. They are Professor Eli Wahyudin from Faculty of Pharmacy, Unhas, Dr. Agus Salim Bukhari, PhD from Faculty of Medicine, Unhas, Professor Andi Wardian Sinrang from Faculty of Medicine, Unhas, and Gavrila and also Arfiani, they are from Faculty of Nursing, Unhas. Ladies and gentlemen, as we know that quality of health services must be delivered effectively and safely to achieve optimal or desired health outcomes. Thus, hospitals as health service providers are required to identify and to provide a continuous effective health services for quality improvement that must be safe, patient-centered, effective, efficient, timely, accessible, and also equal. However, previous studies show that more than 15% of deaths, 107 million cases of morbidity, and 10% of patients hospitalized got infection due to poor healthcare quality in low and middle income countries. What about in Indonesia? Research results in Indonesia also depicted that among 6 hospitals in South Sulawesi province, only 1 hospital met the minimal health service standard, is as patient satisfaction. The National Health Insurance, BPJS, is one of the government strategy that aims to control healthcare costs and avoiding unnecessary healthcare services while keep providing decent care to the patients by implementing the INA-CBG's payment system. However, previous study reported that the implementation of INA-CBG's led to fraud, including upcoding, unbundling, substandard services, a lengthened stay, and hospital readmission in order to address the low INA-CBG's tariff. Therefore, the INA-CBG's implementation must be evaluated. However, we found that only few studies conducted evaluation on healthcare quality received by insured patients with the INA-CBG's payment system. Hence, this study aimed to evaluate and to compare healthcare quality received by insured patients hospitalized in 2 Indonesian regional public hospitals. This study is a secondary data analysis using from the patient data extracted from the 2019-2020 BPJS Health Insurance e-claim databases. And for the 2 hospitals, we included all the insured patients that hospitalized in both hospitals during January 1st until December 31st, 2019. And then also those who were hospitalized and discharged from January 1st until March 30, 2020 for Hospital A. Hospital A is a public hospital with 358 beds. And then Hospital B is a 283 bed public hospital. And then for this study, we included all insured patients hospitalized in Hospital B from January 1 or January 1st till December 31st, 2019. And then also those who were hospitalized and also discharged from January 1st till July 31st, 2020. So we also use study measures for this study. using the three concepts of healthcare quality model initiated by Donabijian. So there are three concepts: structure, process, and outcomes. For the structure, it consists of patient characteristics, which is included sex and age of the patients, and then types of inpatient wards, and then total admission. And for process, it comprises INA-CBG's diagnosis and length of hospital stays. And then the last one, outcomes, it encompasses the discharge status and hospital costs, and also 30-day hospital readmissions. We already obtained the ethical clearance from the Faculty of Medicine, UNHAS, and then also we use a descriptive analysis for this study. So what are the results? The results is, first, we found that the characteristics of the patients hospitalized in both hospitals were similar, as we can see in this figure, figure 1A for hospital A and figure 1B for hospital B. We can see here they have similar characteristics. As we can see, all patients are coming from, or they have various ages. So all age groups are found in both hospitals. And then, as we can see here also, in 2019, they have higher total patients than in 2020, because 2020 we got pandemic, COVID-19 pandemic, so therefore the number also decreased. What else we found from this study is that in both hospitals there are financial loss due to various factors. So as we can see here in hospital A, in both years, 2019 and 2020, there were financial loss in the hospital A. And also in hospital B, there were also financial loss, and it's very high in both hospitals. So after we try to explore what are the factors and why there were financial loss in the hospital, so we found out that there were 6 diagnoses of INA-CBGs that were categorized as high volume because of the number of the diagnosis, and then high cost because it caused the financial loss for the hospital, and then high risk because similar INA-CBG's diagnosis, but patients were hospitalized in varied length of stays. As we can see here, in 6 INA-CBG's diagnosis, even though they have or the patients diagnosed with similar diagnosis, but they were hospitalized in various length of stays. As we can see here, most of them were hospitalized for 4 till 5 days. However, even though they are hospitalized less than 9 days as the standard of the Ministry of Health, but they still cause the financial loss for the hospitals. And this trend was also found in 2020 in Hospital A. Compared to Hospital B, we also found the same picture, the same trend, where we can see here that even though the patients were diagnosed with similar diagnosis, but they were hospitalized in various length of stays. As we can see here, head injuries, BP, and other INA-CBG's diagnosis, the patients were treated with the different length of stays. And it also caused financial loss. And this also found in 2020. Yeah, even though of different INA-CBG's diagnosis, but still we found the same trend where patients were hospitalized in different or various length of stays, even though they have diagnosed with similar diagnosis. So what happened from these results? So we found and we reported that many patients in 2019 and 2020 were hospitalized less than 9 days, which is actually good. But even though they are diagnosed with similar diagnosis, but they were hospitalized in various length of stays. And also with the various length of stays caused the financial loss of the hospitals. So it means that this is a big problem for both hospitals. And then the second finding that we found, discharge status of index admission was actually based on physician approval, which means patients were discharged from the hospital or from the previous hospitalization were based on physician approval, which means patients were cured or patients were in a good condition. But what we found in this study, patients still experience with 30-day hospital readmission rates, which means patients were admitted again to the hospital, even though with different diagnosis, but still it is named as 30-day hospital readmissions. And it shows that the quality of healthcare services in both hospitals were poor. And national indicators already stated that the 30-day hospital readmission must map less than 1% for all hospitals. But what we found in this study, it's more than 1%. What else? The other finding from the study that we try to figure out and explore what are the contributing factors to the hospital financial losses for both hospitals. And we found for Hospital A, they were medications, medical devices, surgical procedures, medical consumables and disposables, intensive care costs, and also hospital accommodation costs as contributing factors that led to financial loss for Hospital A for both years, 2019 and 2020. And what about in Hospital B? In Hospital B, we also found that medications, hospital accommodation, medical consumables and disposables, surgical procedures, nursing care, and intensive care costs, and also lab tests were identified as contributing factors to the hospital financial losses for both year 2019 and 2020 in Hospital B. And so what we suggest here that developing clinical guidelines and implementing integrated clinical pathways through interprofessional collaboration that is framed in the professional nursing practice model are suggested to enhance good quality care for patients hospitalized in 2 Indonesian regional public hospitals, because we found that clinical pathways are needed to prevent all the, the incidents or the variance in the patient outcomes. So by implementing the clinical pathways, we hope that no more variance in patient outcomes, and it can reduce hospital costs, and it can prevent the 30-day hospital readmissions. So as a conclusion, the length of stays and 30 days readmission rates found in the study were still under the hospital service minimum standard. And as I mentioned before, that to overcome these problems, integrated clinical pathways based professional nursing practice model is highly recommended to decrease length of stays, to avoid variance in length of stays, and then to reduce hospital costs and to avoid or to prevent the 30-day hospital readmission rates. Thank you so much for your attention, and we hope that our studies can give benefits for other researchers and then to other future studies. Thank you so much. Wassalamualaikum warahmatullahi wabarakatuh.